Good evening, everyone. This is Marsh Noel, Assistant to the City Manager and your moderators for tonight's call. Thanks again for joining us for another community teleconference on COVID-19. We're always appreciative of all those who take the time out of the night to join us and to stay updated on what the city is doing during this pandemic. This evening, as we always have, you will be hearing from members of our Emergency Operations Center on updates related to various things that are going on. Our speakers for tonight are going to be the City Manager, Jonathan Evans, Interim Fire Chief, John Curd, our Interim Public Works Director, Terrence Bailey, Finance Director, Randy Sherman, and finally, our Human Services Section Chief and also our YEP Director, Ms. Valerie Grimsley. As always, during the course of the call, we do encourage that you tell your neighbors, your families, and your friends about this call so that they too can connect and hear the valuable information that you'll be hearing tonight. As always, the first portion of our call will consist of the updates that you'll be hearing from members of our Emergency Operations Center. Afterwards, we will open it up for questions and answers. When we get to that portion, I will allow for lines to be unmuted for those who have questions, and that instruction will be provided later. And with that being said, I will now turn it over to our City Manager to begin with his report.
Thank you, Ms. Noel, and thank you, residents of Riviera Beach and staff, for your efforts with regards to the city's response concerning COVID-19. As we're well aware that this virus has impacted our state and our region exponentially more than other areas in the state of Florida. And pursuant to the executive order that was issued by the governor, which exempted Palm Beach County, Miami-Dade County, and Broward County from opening into phase one, there is movement that one can anticipate the county looking to effectively move into the phase one operations. They are lobbying the governor to consider taking that stance, as we've seen the number of cases in the county holistically go down. One of the things that we are doing from the city's perspective is having the conversation as to how we are to move forward with our reopening of certain municipal operations. We know that some of our operations will still remain remote or be in a hybrid fashion where there will be certain staff that will be required to be on site, and some will be providing services remote and alternate schedulings to ensure that we're adhering to the guidance and recommendations that are provided by the CDC. City staff has begun working on creating that model and building out that model, and we look to deploy that starting as early as May 17th, which is a Sunday, but effectively taking hold in the agency on May 18th, assuming there's no deviations or changes as a result of the virus and how it's making its way through our community. The intent behind starting that on the 18th is to allow for the appropriate cleaning and preparation to restore operations. As it relates to face-to-face interactions or meetings or engagements with the public, those will still remain in a remote fashion until June 1st. The intent behind that is to continue to watch what the virus is doing and to ensure that we do not jeopardize the health, safety, and welfare of our employees nor the public. We will be outlining some additional digital tools and pieces of information that will assist our residents in operating in this new normal. We understand that municipal services will start to begin again, but there's certain elements that will be continued as it relates to our emergency response. We have been able to establish a human services division that is led by Ms. Valerie Grimsley that is providing much needed nutrition to our residents in our community, Also delivering meals to our young folks that parents may be working or don't have transportation assets. So there will be a social service arm of the agency that will still remain in existence for some time until we're able to better understand exactly what the social and economic impacts are related to this particular pandemic. I can tell you some things that the residents of this community should be very proud of, and it is a testament to the leadership and direction that is being provided by the City Council and the effort that is being displayed and distributed amongst all the employees as it relates to the COVID-19 cases in our community. Per 1,000 residents, we're averaging just under one person experiencing the virus for every 1,000 individuals. So that roughly is about 33 to 34 individuals in our entire community out of 34,000 that have tested positive for COVID since it has impacted our community. When you look at other communities, our numbers are the second lowest, and the lowest is Lake Park, and they're at 0.79%. And I can tell you at any given day, we can probably find ourselves as lowest in the county. So that is good news, and that means that the community is responding to some of the guidance and direction that's been provided by the CDC, and we must continue to do that to ensure that our numbers remain low. Having a very diverse community, we understand that this virus preys on situations where individuals have immune deficiencies or have pre-existing conditions, and so we're very conscientious of how it's impacting our community and how we are prepared to be able to respond. So continue practicing your social distancing. Masks are so important. The city will be embarking on a very innovative and creative mass distribution solution. Our initiative is called Mask Up, and I have to give credit to the city attorney that came up with the slogan, but we are actually going to be mailing out 16,000 surgical masks to residents in the city of Riviera Beach. So you can anticipate in the next couple of days, probably in the middle of the next week, that you're going to receive a letter from the elected officials with 5 surgical masks. And so please don't disregard that, read the letter. And this is our way of saying, please be careful, mask up, and understand that we're not out of the clear yet. And so it's important that we continue to follow all the information that's being provided by reputable sources. Some other information that I think is relevant to the conversation: when we report our costs to the county as it relates to COVID-19, the city of Riviera Beach has reported about $320,000 associated with COVID activities, and is about $9 per resident as far as the monies that have been expended. Palm Beach Garden is at $36 per resident, Boca Raton $21, West Palm $11.60. Palm Beach is at $9. So we have been doing fairly well with regards to managing the resources that we do have, but also leading the way with regards to the activities that we're doing in our community that far exceed those of other agencies, because we believe that being responsive and being active and making sure that we are combating the social as well as the operational side holistically has led to the numbers being significantly lower in our community. We've been able to establish some testing in our community, and that's a testament to the leadership at the state level, Senator Bobby Powell, Representative Al Jaquette, to the county, Commissioner Mac Bernard, the elected officials, Mayor Ronnie Felder, as well as Vice Chair Doug Lawson, were advocates and staunch supporters and really made it known that the city of Riviera Beach wanted testing within our municipal boundaries, and partnering up with the Black nurses practitioners of Palm Beach County, we're able to deliver that to the community. That started last week, Saturday. We have testing again this Saturday from 9 to 12. The lines are still open, and we're accepting appointments until 8 o'clock this evening. So, and this is community-wide. This is not something that's exclusive just to Riviera Beach. So if you have friends, family members, or individuals that would like to be tested for COVID-19, there's no cost associated for it. The number is 561-318-0280. Again, that's 561-318-0280. Staff is on the phones. They're there to assist. And then it's a very quick process. The testing from when you come in to the drive-through site takes a total of about 5 minutes. So we certainly are going to get you in and out. And then we've posted information as to when you can anticipate receiving your test results. And then you can call the number and they can provide you additional information. One of the things that is coming on the horizon, we will do another mask distribution, but this will be cloth masks. We were able to procure possibly about 10,000 cloth masks, and we'll be giving those out to the community as soon as we're in receipt of those. And so, in a nutshell, the city has been doing a exceptional job, and I really do believe that we've been leading other entities in Palm Beach County without how aggressive and progressive that we have been. One of the things that is coming to a decision point is the beaches. We know that there's been a lot of phone calls, a lot of emails. I constantly get your emails and phone calls with regards to the beaches being closed. Palm Beach County gave me the opportunity to serve on a committee with other municipal managers to talk about the beaches and reopening the beaches. The conversation has been productive. The Board of County Commissioners will be discussing that matter tomorrow at 9:30 a.m. The city's position has been that we want to make sure it's consistent with the direction the county goes, as well as our partners to the north and our partners to the south. Having different rules and regulations and stipulations just adds for confusion to the public. So our position is that we do not want to put a strain on resources as it relates to enforcement. We want to have all the recommendations that you're seeing executed in Clearwater Beach and Sarasota County with regards to social distancing, no parties larger than 10, and asking folks to operate responsibly. So we are pleading with the community that in the event that the beaches do open in whatever form or fashion that looks like, that people adhere to the rules and regulations that are set forth. They're only intended to protect us, and they're going to safeguard not just you, the public, but as well as our public safety personnel that will interact with you. We're also building out some models as it relates to lifeguards and how they will have the appropriate protective equipment in case they have to render service. And so there's a lot of things that are consistently happening, but we should be putting out information as soon as we possibly can concerning the beaches. If you are interested in reading the executive order or the draft executive order that the county is working on, that is available on Palm Beach County's website. That website is pbcgov.org. And if you go under their agendas, you look for the date, which tomorrow's date is the 5th of May. And their meeting starts at 9:30. You can just click on the agenda and you can see the draft executive order there for you to look at what the county is considering. So again, thank you so much for listening to our community conversations, and I hope you find these to be valuable. Staff puts a lot of time, energy, and effort to make sure that you're informed and in the know. And at this particular time, I turn the call back over to you, Ms. Noel.
Thank you, Mr. Evans. Next up, we'll be hearing from Chief Kurd.
Good evening, everyone. My name is John Kurd. I'm your interim fire chief, serving as the operations chief in our EOC. I want to have some discussion tonight about some of the data and science, the numbers that are being used in some of the decision making that is going on, and using this data to make sure that we're providing the best level of protection to our communities. We're going to start off by current statistics. These were updated with the Florida Department of Health's website this morning at 11 a.m. And in Florida, there are 38,822 cases. Remember, all of these numbers are cumulative numbers. This is the total since the beginning of the pandemic. In the state of Florida, there's been 1,600 deaths reported, and currently there is a 9.4% positivity rate in the state of Florida. Palm Beach County cases, there are 3,587 cases that have been reported out of Palm Beach County, with 222 deaths being reported. At the beginning of the pandemic, we had percentages of 18% of the patients that were being tested were positive. Now in Palm Beach County, we're down to a 6.6% rate of positive results from individuals that are being tested. In Riviera Beach, there have been 39 total cases from the beginning of the pandemic. I've done a 2-week retrospective, and to my best estimation, there are somewhere between 8 and 10 positive cases currently within our municipal boundaries. We are seeing a continued downward trend in the total number of cases. However, it's very interesting when you look at the data, and you need to be very careful when you look at data. While we're looking at the percentages of new cases are going down, we are still seeing higher number of new cases. That's simply because of all the testing that is available. There are over 27 different sites in Palm Beach County now that are offering COVID-19 testing. So we are happy to see a downward trend in percentage, but we are seeing spikes in numbers simply because of the sheer number of tests that are being offered. So this is a reminder to not be lulled into a false sense of security. We still have a pandemic that is ongoing. There still are new cases being reported daily. We do see an overall trend declining, but it has not gone away, and it is by no means over. So be cautious when you look at and interpret data. Some more data for you. There is mortality rate data from APM Research, which is an independent lab that has been working with 38 different states and Washington, D.C., who have been collecting demographics as it relates to COVID-19. And there's been some very interesting numbers, and I'm going to go through a lot of them, and I'll be available on the line to clarify any of this. But I'm going to go ahead and move through this as quickly as possible. So of these 38 states and Washington, D.C. reporting, it has been reported that for each 100,000 Americans that contract COVID-19, 37.2 of the deaths are Black Americans. Asians are 16 deaths. Latinos are 15.9 deaths per 100,000, and whites are 14.3 deaths per 100,000. This is a very disproportionate number and is very concerning to us. So let me provide some additional data to provide a little bit of context to that information. Nationally, Black Americans make up 13% of the population of the states that are reporting, but they have suffered 27% of the deaths. Worst case scenario right now is Washington, D.C. The population of Black Americans in Washington, D.C. is 44%, but they account for 80% of the deaths. In Florida, Black Americans make up 15% of the population and account for 22% of the deaths. So Florida is definitely nowhere near what a Washington, D.C. is, and we are below the percentages of deaths nationally. And in Riviera Beach, we are even well below those numbers, as articulated by Mr. Evans in the number of cases per capita here in Riviera Beach. Why is that? Well, it's really the work of you all, the community, adhering to government recommendations, the education that's been provided, adhering to CDC recommendations on social distancing, hand washing, staying at home. And please remember, while the city of Riviera Beach stands ready and stands behind you, we are only a support mechanism. You all are the ones that are going to be able to stop this pandemic. Adhering to the government's recommendations of social distancing, staying at home, wearing masks, ultimately, it's going to be up to you, the citizens of Riviera Beach, to get this pandemic under control and keep it out of our community. However, Riviera Beach operations stands ready to continue to support your efforts, and we're going to do that through continual mass distributions throughout the community. We are going to be in the tens of thousands of masks that have been distributed throughout the community by the end of next week. We're going to continue community testing. We've had a very successful testing site operation started last week, will continue this week, and will continue as long as tests are available and the demand is there by the community. Tomorrow morning, I am working with Palm Beach County. We are mobilizing a team to do testing for special needs individuals that are bedridden and that are registered with Palm Beach County Special Needs Shelter, where we're going to have a mobile testing unit that is going to be going to their residences and provide them with testing that they would not be able to get otherwise because of their medical conditions. And we're happy to be able to support that special needs population in our community. We're going to continue with food distributions. As long as the supplies remain available and as long as we need to, we will stand ready to provide for our community who is struggling financially due to the job losses that are experienced here in the state of Florida. We are also looking into additional testing for our community. There are other test options that are out there. We are meeting several times a week with different groups to discuss the possibility of bringing antibody testing to our community, which is going to be an indicator of what the coronavirus has done to our community, who may have antibodies to the coronavirus, who has not yet contracted the coronavirus. Again, more of that science that's going to be needed to help drive our decision making. As we transition our EOC to a recovery effort and right size for the next phase of reopening, we will continue to build our Health and Human Services branch for continued community support as long as that support is needed. And I want to wrap up by finally reminding everyone hurricane season is rapidly approaching. I know many of you all may not want to hear this, but our responsibility and obligation out of the EOC is to look ahead and plan for and ensure resilience of our community moving forward. Please take the appropriate actions to be ready and don't get caught off guard as hurricane season is just right around the corner. With that, I turn it back over to you, Ms. Noel.
Thank you, Chief Curd. Next, we're going to hear from Ms. Valerie Grimsley.
Good evening. Currently, we have 2 distributions of food weekly. Tuesday at Wells Gym starting at 10 and going through 12 o'clock. It is a bulk produce. Only vegetables and fruit will be given out on that day. And on Fridays, we go from 9 to 11 o'clock. And that is more or less your grocery box. Consists of meat, vegetables, milks, just different things like on that list. We are doing, in addition to that, we partner with several different outreach communities, agencies that actually feed on Monday, Thursday, and as well as Christ Fellowship is now feeding on Saturdays as well. We currently have fed 7,298 persons, which includes nightly meals to our senior citizens, which now is up to 300 persons that receive a nightly hot meal prepared by chefs. In addition, we We actually transport 150 meals to students in the mornings so that they can have lunch. And those are the students that Mr. Evans was speaking of that do not have transportation. In addition to that, we're also making sure that Heron Estates, which is our senior citizen complex located on Congress Avenue, Villa Franciscan, which is also located on the east side of the tracks near E Avenue, is also receiving meal boxes of food and different types of produce that come in to make sure that our senior citizen residents that cannot get out can also receive food that they can prepare at home or receive food that is already prepared for them. As Chief and Mr. Evans stated, we've also done mass distribution to date. We're coming up on almost 36,000 masks that has been distributed. With that, I turn it back over to Marcia.
Thank you. Next, we're going to hear from Randy Sherman.
Good evening, everyone. This is Randy Sherman, your Finance Director, serving as the Finance Section Chief. I will begin again with the utilities, as I do every week. We have no operational changes with the utility billing and customer service group. We continue to provide services at the level that I think you've all been accustomed to. I do want to point out an interesting trend that we are seeing. We're actually getting a lot of new accounts in our rental properties within the city, but we're actually seeing a decrease on lien searches, which means we should expect to see a decrease in purchase and sales of properties over the summer. And I do apologize in advance. I know you've had a lot of numbers tonight, but I'm going to throw a few more numbers out. Every day we receive reports on COVID-related hours. So these are the hours that staff is spending on specific COVID activities. We have just crossed the 4,300 hour mark today with the reporting. The cost that we have reported to date to the county is $320,000. That is really through payroll through April 25th. So as we get the payroll completed this week, we could expect that number to increase. As the city manager mentioned earlier, that spending is roughly about $9 per resident. And then finally, I understand I was cutting out last week. Let me just mention last couple points that I had last week. The city did receive a payment from the federal government of $20,666. That was a distribution as part of the Federal CARES Act. And the police department is in the process of filing a grant with the Department of Justice for COVID-related expenses in the amount of approximately $109,000. Ms. Noel, back to you.
Thank you, Mr. Sherman. And finally, for our reports, Mr. Terrence Bailey.
Terrence Bailey, Public Works Director, acting as your Planning Section Chief. As you've heard with all the activities of my predecessors, the Planning Section stands in support from technology, data warehousing, GIS support, and other operational elements. We are working with the executive team on the Phase 1 reopening, as well as building out the operational model on a more long-term go-forward basis after we exit this current crisis with COVID, what the city's function and operations will look like. We will not be going back to business as usual, and it will take a lot of not only physical changes, but operational changes to the way the city does business in every department. And we are currently looking to maximize interaction with the public and providing the highest level of service while still maintaining the highest level of safety for all involved. And with that, I end the planning report and I turn it back over to Mr. Evans.
Thank you,
All
Mr.
right.
Bailey. But I'm going to turn it back over to Ms. Noel to do the communication.
Thank you. Yes, so I'm also serving as Public Information Officer for our Emergency Operations Center, along with Mr. Walter Stevens. In terms of what we've been doing up to this date, we have been on a frequent basis posting valuable information to the community on the various activities that we've done since our emergency declaration. We continue to ask the community to stay connected. Go to our city's website. You can visit rivierabeach.org/COVID-19 for daily updates or regular updates on all matters regarding the pandemic. If anyone has any questions regarding COVID-19, regarding city operations or what we are doing, they can call 561-812-6597. And that ends my report. Mr. Evans, would you like to take it on from here?
This particular point, this is when we allow for the Q&A, if anyone in the public has any questions before we conclude our conversation with the community. But thank you, everyone, for listening in. The information is very important, and I believe that the city has been one of, if not the only agency that is providing these updates to the population. And based on the data and information that has been obtained through the communications team, our reach has gone well into over 100,000 people. So we know that individuals from outside of our municipal boundaries are watching and listening and taking note of what we're doing. So kudos to the efforts. But that concludes my comments, and we're prepared. The team is prepared to answer any questions that the public may have.
Thank you. And with that, if you do have any questions, you can dial *9 so that I can unmute your line. All right, I do see a hand raised. I will unmute your line. If you can please state your name. Or perhaps there isn't a question. All right. If there are no questions, then we are about to adjourn the conference call. All right, seeing that there are no hands raised or that no one has dialed the *9, I do want to leave us with a few announcements. As you can see, if you've been following the city on social media, we have been trying our very best to promote two important initiatives going on. One is for the 2020 census. We have been pushing out videos and flyers and information to the community about the significance of participating in the 2020 census. Currently, we are at 45% response for our community. We are very close to beating our record back in 2010, which was at 52% overall. And so we continue to encourage the community to not only fill out the census, but to also encourage others to do so as well. And then lastly, we have the community value survey, the city survey, which is separate from the census, but very much important. If you have not yet filled that survey out, you can do that online by going to surveymonkey.com/r/Riviera Beach. And with that, that concludes my announcements. Thank you all so much for joining us for another community teleconference. You can look forward to another conference call next week for our elected officials on Thursday at 6:30. Please look out on social media. Thank you.